Apocalypse now. Coronavirus cases still not boosting weekly death numbers yet. April 3rd, 2020. Today, the Centers for Disease Control released their latest weekly death numbers for pneumonia and influenza. These are updated weekly and put out on the CDC website. There's a link to the CDC website for this in the show notes. Now, if coronaviruses are, or specifically COVID-19, is unusually deadly, and given the limited state of testing and so forth going on right now, we would expect to see many coronavirus cases not diagnosed as coronavirus and included in these numbers, simply because the testing isn't rolled out yet, simply because it's probably imperfect, it's very new technology. These numbers should be showing an increase at some point, but they aren't so far. The emphasis is placed on so far. As we'll see, there may be some problems with collecting these numbers. So here are the latest numbers from the latest file posted on the CDC website Friday, April 3rd, 2020. So these are the numbers for week 12 of 2020. And I put this in a spreadsheet and added a couple of columns, so I combined the year and the week for each row into a numerical date, and I combine the deaths attributed to pneumonia and those attributed to influenza, which is actually a small fraction of the deaths, in a single number. So for week 12 of 2020, the latest week, we see 3,261 total pneumonia and influenza deaths. Note that this is less than week 11, the week before, 3,694, which itself is less than week 10, 3,933, and so on. We'll see that there's basically a peak and a drop. There's no sign of the numbers turning back up in the United States so far. In 2019, 1 year ago, in week 12 of 2019, the total number of deaths attributed to pneumonia and influenza was a much larger 4,274. 2019 also had the same pattern of it dropping. So there are actually, according to these numbers, about which there's some reasons to be cautious, but according to these numbers, a lot more people were killed by pneumonia and influenza last year than are so far being reported this year. To repeat, the latest numbers for 2020, week 12, this is actually the week ending on March 20, for one, I believe. We'll recheck that as we go forward. But anyway, the latest week for which they have numbers, which is a couple of weeks ago, week 12 of 2020, 3,261 people died from pneumonia and influenza, according to the official figures. In 2019, week 12, we have 4,274. And again, the number reported dead this week is less than week 11, which is less than week 10 in 2020. So these are the weekly pneumonia influenza deaths in the file, which goes back to the end of 2013. And they're typically bouncing between or moving between about 3,000 deaths per week up to peaks in the center in the winter of 5, 6, 7, even 7,000 in 2018 when there was a big surge in deaths. You can see they vary significantly. It's not a simple repeating pattern. It is a repeating pattern. And this shows the pneumonia and influenza deaths right now, right here. And you can see they're not appreciably bigger than last year, and they seem to be dropping as we would expect if everything was relatively normal. There's no sign of the coronavirus epidemic or pandemic or whatever. Let's look at some more. This is actually a fit of a model that I did to the weekly death rate. So this R squared is essentially a measure of the fraction of the variation in the data attributable to, or so that the model can actually correctly explain. If it was 1.0, 100%, the blue line, which is the model, would fall on these plus signs. Let me go through this a little bit more. So on the vertical axis, we have the weekly deaths, so from 3,000 to about 7,000. On the horizontal axis, we have the week, which is measured in years. So for example, at the midpoint here, say on week 26, we would say we are at 2015.5 because we're in week 26 of 2015, and there are 52 weeks in a year. We divide 26 by 52 to get 0.5, so this number is a numerical date in years, but it's weekly data. The plus signs represent the actual data from the file on the CDC website. The red is a linear trend, and what we can see is over time, the number of people who die each week is declining, probably due to medical advances and other factors, technological progress. The blue line involves a repeating, loosely sinusoidal pattern added to the red line that fits the data moderately well. As we can see, there's something going on here that we can't get in this model. Both the CDC website and the European mortality monitoring website, which I'll mention at the end of this presentation, have a similar type of model. They have some sort of a sinusoidal repeating pattern added to a linear trend, and they also can't really explain or model some of these variations. These surges during the winter in particular are quite different from the underlying model we're trying here. You can see again, it's actually the data so far is falling below the model, and of course is, as I indicated, below the data from last year, comparable time last year, by a significant amount. Again, what this means is that there's no sign yet in this data from the CDC and the National Center for Health Statistics of the increased deaths attributed to pneumonia influenza we would expect from undiagnosed cases of the coronavirus pandemic. So again, not everybody is being tested, not everything is known. We would expect to see some type of surge, and fairly dramatic if it's extremely deadly, as is often being claimed. We are not seeing that surge yet. Now, this is important for sort of context and to explain something on the CDC website that's confusing. So this is all causes weekly deaths. So this is the number of deaths every week from everything: heart attacks, cancer, strokes, every cause of death, not just pneumonia and influenza. Should in principle also contain the coronavirus deaths, because they should be included in all deaths. And remarkably, we see a dramatic drop in the last couple of weeks. This is almost certainly some type of problem in the mortality tracking system. I'll discuss that more later. But the point is, it moves around, surging during the winter between about 50,000 and 60,000 deaths. So these surges appear to also occur in things other than pneumonia and influenza. And on the horizontal axis, we have this numerical year date. And on the vertical axis, we have the weekly deaths, the number of people who died that week from all causes. All causes means heart attacks, cancer, strokes, a wide variety of diseases, accidents, homicides, pneumonia and influenza. And it should actually, based on the description, include all the deaths attributed to the coronavirus, to COVID-19. Remarkably, this data actually shows a dramatic drop in the last couple of weeks, and of course it doesn't show any sign of a surge due to the coronavirus either so far. This is the CDC website this morning. It's April 3rd, 2020, a Friday, and they updated their website with the latest data. Sorry, there was a jump there. So this is pneumonia and influenza mortality from the National Center for Health Statistics Mortality Surveillance System, and it's data through the week ending March 21, 2020. But it was put out, I would say, they probably got the data on April 2nd and did the plot on April 2nd, but it was actually posted on the CDC website today, April 3rd, 2020. So it's worth understanding this plot because it seems to show a spike, as you might expect, from the coronavirus COVID-19. It is misleading. So on the horizontal axis, we have basically the week of the year. So we have 2016 week 20, and here we're at week 13 according to their scheme for the year 2020. So there ought to be a 2020 here, but there for some reason couldn't print it or something. Okay, so the horizontal axis is the date, the time, basically the week of the year. And what they're plotting in red is actually the percentage of all deaths due to pneumonia and influenza. So it's not an absolute count as in my plot. It is a percentage. So it's saying that the percentage of deaths attributed to pneumonia influenza, so if you take the number of deaths attributed to pneumonia influenza and you divide by all deaths in that week, you get this number. You get a percentage. And that has surged. Why has that surged? The reason it has surged is because here the weekly all deaths dropped dramatically from the normal 50,000 a week to 40,000 a week. It's not clear why that is. It could be that there's a lot of chaos, and as a result, the death certificates and reports are not getting tabulated correctly. It could be that because people have started to, shelter in place, stay at home, and so forth, they simply aren't having as many accidents, homicides. They're taking it really easy, and so you're getting fewer deaths. Those are a couple possible reasons. It could even be an indication that someone is tampering with the figures in some way, that they're being manipulated by someone. It could indicate a wide variety of possible explanations. There isn't really anything I could find that explained this dramatic drop. And in fact, the language here seems incorrect. So what they say beneath the plot is, while the percent of all deaths due to pneumonia and influenza has increased during weeks 9 to 12, the percent of all deaths with influenza listed as cause have decreased over this same time period. And here's the whopper. The increase in pneumonia deaths during this time period are likely associated with COVID-19 rather than influenza. That seems to say that the number of deaths attributed to pneumonia has actually been going up the last 3 weeks, and that's not in the data. Actually, it's been dropping. It's continuing to drop. Now, the rate has gone up the last couple of weeks because the number of total deaths has been going down the last couple of weeks rather dramatically. But it does not reflect an increase in the total number of deaths. Now, if you go into the fine print, and this is actually from a week ago, so they may have changed the fine print, but the point is they actually say somewhat contradictory things about these mortality surveillance figures in the fine print about this data. So they say, to allow for collection of enough data to produce a stable, emphasis stable, pneumonia and influenza death percentage, and remember, it's a percentage, NCHS, that's the National Center for Health Statistics, surveillance data are released 1 week after the week of death. The NCHS surveillance data are used to calculate the percent of all deaths occurring in a given week that had pneumonia and/or influenza listed as a cause of death. The use of the term stable seems to imply that the revisions that you would have, if any, to this data are going to be pretty small. You have enough data and it's already been collected to get a stable number. That's why they wait a week, so that death certificates come in during that week and they get everything up to date. However, they then say the pneumonia and influenza percentage for earlier weeks are continually revised and may increase or decrease as new and updated death certificate data are received from the states by NCHS. That's the National Center for Health Statistics. In fact, as I've gone through these files the last couple of weeks, there's been some fairly significant large changes. In my earlier video on this from last week discusses a fairly large change last week. And that is relevant to this remarkable drop in the total number of deaths per week that they now are reporting and in the details, and yet the sort of the headline that you see on the website is actually talking about an increase in pneumonia deaths, which is a misinterpretation of this percentage that they have plotted. What about Europe? After all, there's been a lot of talk about Europe. Well, remarkably, European mortality figures up until last week, not this week, up until week 12, showed absolutely no indication of the coronavirus. That is, again, that they were normal. They were normal death rates, actually lower than last year, the same kind of thing we're seeing in the United States. However, they are reporting it's hard to say, some increase in the latest data this week. And they waffle, they say, must be interpreted with caution as adjustments for delayed registrations may be imprecise. So this is a system that in principle is presumably for detecting surges in the death rate caused by new causes of mortality, which could be, of course, diseases, viruses that we don't know about. It could be toxins in the environment, pollution. It could be something, weapons, biological weapons attacks, all kinds of causes. So this is the actual data, and so if you look at this data, it's broken down by years, and then they have all ages. So there's really nothing visible until you look at the people who are 65 and over, and you see an increase. I wasn't so far able to find the actual numbers, so it's a little unclear how big this uptick was. It's certainly not enormously large relative to the variation in this data. As you can see, we have these surges during the winter that go above the model. They're using a sinusoidal repeating pattern model similar to the CDC or the one that I showed you. However, those models don't explain what happens in the winter. In particular, during the so-called flu season, you get more deaths. And this is all deaths. This is all causes. And this almost certainly includes factors that go up in the winter besides pneumonia and influenza deaths. And you can see they bump around. You get a double peak here. You get all kinds of variations. And there's a significant variation from week to week, even outside of this period. And so they are getting something here. But it's not very large, actually, relative to the size of the total deaths. Remember, something like 50, 60,000 people a week die in Europe, very similar to the US number. So what does this mean? Well, first, it's important to remember the coronavirus mortality rate is claimed to be unusually high compared to most diseases that are diagnosed as pneumonia and influenza. So numbers like 1.4% and higher have been thrown around. Whereas the comparable numbers for the quote common cold, which actually can be all kinds of things, most of these, the flu, influenza A, influenza B, other viruses that come and go, is supposed to be something in the range of a fraction of a percent, 0.02%, 0.01%. It's pretty low. But again, there are 300 million people in the US, so, and somewhere probably everyone gets one of these diseases in the flu season every year. So 0.02% turns into 50, 60,000 people a year, somewhere in the range of 3 to 7,000 per week. Now, the reported mortality rate that you hear in the news or even these other things is something like the number of deaths that occur where there was a test of some sort done, and it's not clear what these tests actually are. They vary. Some of them are PCR, RNA, DNA tests. It's very confusing. There's many different tests being talked about. But it's a number of deaths where a test was done indicating that the person had the virus, and it may involve attributing the death to the virus or not, and then dividing by the number of persons who tested positive. That's everyone. So many people will test positive, they don't die, and we're concerned with what percentage of those are dying. That depends on who was tested and how good the tests are. The actual mortality rate is the number of deaths attributed that are caused by the disease among people infected with the disease divided by the number of persons actually infected. So many people who aren't tested are probably infected. That's why the number of people infected is soaring. It's because the tests are being introduced and more people are being found who are infected. They don't necessarily die. So at present, we almost certainly don't know the actual mortality rate, which again is an age-related rate. It doesn't appear to be that high for people in their 20s and 30s. But it goes up with age, with pre-existing health conditions, and unknown other factors. For example, pollution in the atmosphere might be a major factor. So the reported mortality rates are a function of who gets tested and how sick the people who get tested are, and various issues with the tests. We don't know how good, it's not clear how accurate the tests are. So the sick, hospitalized, people who don't feel very good, high risk people are likely tested first. They also are more likely to die. I mean, if somebody goes to a hospital with something, they're not feeling very good, they're probably at a higher risk of dying than someone who stays home, who doesn't feel, may not even notice that they're having any kind of health issue. It's not a cross-section of the population. So specifically, let's say for the sake of argument that the coronavirus tests had a very high false positive rate. So they frequently identify the presence of the coronavirus, the COVID-19 virus, the so-called SARS-CoV-2. They do that for people who just have, the common cold. They have something else, right? And one applies these tests to people, you get a huge number of people infected. You also get a huge number of people whose deaths are attributed to the coronavirus because the test has a high false positive rate. That's an example of one of a number of scenarios where you can get a very, very misleading set of numbers. What you need to know is the actual mortality rate. Given all that, nonetheless, if the actual mortality rate is a few percent, it's much, much higher than the diseases we normally encounter, and that cause, again, 55,000, 60,000 deaths per year in the United States. A few percent death rate should show up as thousands of deaths per week shortly. It should actually be very obvious. again, at present we don't have universal testing, for example, and therefore many of the deaths will get listed as pneumonia and influenza. I can't tell from the way that CDC describes it whether the reported coronavirus deaths are also being included in the pneumonia and influenza category. It probably would be best to do that, but even if they're being excluded from that category, there will be many people who have the coronavirus who are not tested, we can't confirm what's wrong with them, who will die from this allegedly highly deadly disease, and therefore they should show up in these numbers. The same is true in Europe. They should also show up in the all-causes mortality, which in principle should definitely include the coronavirus deaths, the COVID-19 deaths. Again, that's in the US, we're not seeing that yet. In Europe, there's some evidence that it may be happening, starting to happen. And one important caveat is it's pretty clear from this large drop in the last couple of weeks in the reported all deaths in these pneumonia numbers that something wrong is happening, okay? Because either that's a figment or a consequence of some sort of delays in reporting deaths or the chaos from the crisis, various things like that could be happening, or even some kind of malevolent manipulation of the numbers. Whatever the cause, that's, if it's not that, then it has to be that the actual number of deaths has dropped because people have changed their behavior, they're frightened, they've been told to stay home, and so they're simply not having as many accidents, they're not having as many other health issues that kill them because of this change in behavior because of the crisis. But it's something very different from what you would see, and so it's hard to know how to interpret those. I mean, the naive interpretation would actually be, bizarrely enough, that this drop is due to the coronavirus, literally, because it somehow is making us live better. Of course, that's very unlikely. But it could be indirectly due to the crisis because people stay home and they don't do things that are risky. They stay warm, they're taking care of themselves, they're being extra cautious, and that's the reason for this drop. I suspect it's more likely that the mortality monitoring system has come down to flaw that's being revealed in the crisis. So this video was produced on Friday, April 3rd, 2020. I'm John McGowan with Mathematical Software. Let me include a disclaimer. We have a disclaimer on our website, and the link is in the show notes. You can read pretty much the same points here. The really important one is the professional disclaimer. So I'm going to read that out. This report cannot and does not contain medical, legal, fitness, health, financial, or other advice. The medical, legal, fitness, health, financial, or other information is provided for general informational and educational purposes only and is not a substitute for professional advice. Accordingly, before taking any actions based upon such information, we encourage you to consult with the appropriate professionals. We do not provide any kind of medical, legal, fitness, health, financial, or other professional advice. The use or reliance of any information contained in this report is solely at your own risk. And I would add, just as a general, so the point, of course, is to see a medical doctor who's qualified, who's properly licensed, or attorney, or whatever you need to do. I myself, several years ago, had a serious respiratory infection that led me to go to the hospital. I had some treatment and other things. It was never satisfactorily explained. So it's important to remember that respiratory illnesses, whatever the specific situation with coronavirus is, and we don't know, and I don't know, these type of infections can be fatal. They're one of the leading causes of death. They're the 8th leading cause of death in the United States. You only have to be without oxygen for maybe 4 minutes. That's the rule of thumb anyway, and you die. So this is something to take seriously, especially if you're having serious respiratory issues, and talk to qualified doctors, medical, health professionals, etc. That concludes this video. If you like this video, please take a moment to click like. Please click subscribe and the notification bell if you would like to receive more content from us. We welcome constructive feedback and comments. Mathematical Software is developing products and services to automate data analysis, reducing the risks of costly errors and improving results. If you want to support our work, you can subscribe on our Patreon page. This is the URL for our Patreon page. Scan the QR code in the lower right corner with your smartphone to get the Patreon link. Our Patreon link is also in the show notes below.